This video is about HPV and cancer. It was developed by the Office of Community Outreach and Engagement at the Columbia University Herbert Irving Comprehensive Cancer Center. HPV is short for the human papilloma virus. There are over 100 types of this virus, and many can be harmful. Some types can cause warts. Others can cause cancer of the penis, cervix, vagina, and on the vulva, which is the skin outside of the vagina. And others can cause mouth, throat, and anal cancers. Anyone who is sexually active can get HPV. It can also be transmitted through childbirth and through skin-to-skin contact. The virus is transferred through tiny invisible breaks in the skin during unprotected sex. You can carry HPV and not know it. You can develop symptoms years after you have sex with someone who is infected. Condoms offer some, but not total protection from HPV, as they don't cover all of the genital skin. 8 out of 10 people have HPV at some time in their lives. How does HPV cause cancer? Usually HPV leaves the body naturally, and you never know you had it. But sometimes HPV doesn't leave the body naturally. The longer someone has HPV infection, the more likely it is for abnormal cells to develop. If untreated over many years, these cells can develop into cancer. HPV can cause cancer of the mouth, throat, and anus in both men and women. In men, it can cause also cancer of the penis. In women, cancer of the cervix, vagina, and vulva. The cervix can be tested for HPV. The cervix is a cylinder-shaped opening that connects the vagina and the uterus. There are things that put you at higher risk for developing cervical cancer. These include having a weakened immune system, having a family history of cervical cancer, a diet that is low in fruit and vegetables, chlamydia infection, having a first full-term pregnancy before age 20, having 6 or more sexual partners in your life, sexual activity before age 18. Women whose mothers took the medication DES while pregnant with them may also be at increased risk. In women with HPV, the following things increase cervical cancer risk: 7 or more full-term pregnancies, smoking cigarettes, and long-term use of the birth control pill. One can get screened and tested for cervical cancer. The Pap test is often done as part of a pelvic exam to check cervical cells for changes caused by HPV that could become cancer. How is a Pap test done? A swab of cervical cells are collected and sent to the laboratory. The cells from the swab are looked at under a microscope to look for abnormal precancerous cells and the DNA from the HPV virus. There are things you can do to reduce your cervical cancer risk. Throughout your life, you can eat fruits and vegetables, not smoke, and use condoms, and starting at age 9, get the HPV vaccination. The screening guidelines for reducing your cervical cancer risk are that at age 21 and through age 29, average risk women should be screened for cervical cancer with a Pap smear every 3 years. Women ages 30 to 65 should get a Pap and an HPV test every 5 years. And at age 65, if you have had regular screenings for the last 10 years, you can stop screening unless you've had a serious cancer in the last 20 years. It is important to note that the only other approved test to find HPV-caused cell changes or infections is the anal Pap test. There is no screening for the other cancers caused by HPV, so it is very important to prevent infection with the HPV vaccination. The HPV vaccine works best when given between the ages of 9 and 12, well before exposure to HPV. Some people do experience mild side effects, such as pain or redness at the injection site. However, this is normal and these symptoms usually go away quickly. The vaccine is very safe and effective. For more information, scan these codes with the camera app on your phone.